A fall is defined as an unplanned descent to the floor with or without injury. The overall risk of patient falling while hospitalized is relatively small, 2 to 3%, but data shows when patients do fall, injuries often occur. Injuries can range from minor to serious or even fatal. Here at Breach Candy, we are very committed to patient safety. As the clinicians are responsible to take care of the patients medically, we also believe that every member of our staff team is responsible for patient safety. In this video, we show you how you can be part of our most important patient safety program, Patient Fall Prevention.
At Breach Candy Hospital, we have a very active fall prevention program to reduce the risk of harm resulting from the fall. All the inpatients at our hospital are assessed to identify the risk of fall using Morse Fall Risk Assessment Scale. Once the patient is assessed as having a high risk of fall, he is immediately incorporated into the fall prevention program.
As the patient gets admitted to the hospital, the staff provides the patient and his relative room orientation.
Good morning, ma'am. Good morning, Mr. Mukesh. You are in Breach Candy Hospital, room number 707th floor. You are here, don't worry. Any problem, there is a call bell on your right side. Ma'am, there is a call bell with a red indicator shows you can press this button. Even you can show this. It will be tied over here so that it will be very nearby for you to press the button. Ma'am, there are 4 side railings on the sides of the bed. You have to just pull it up. In case if it's stuck, you just pull it back and then put it up. If you are not there, if you are leaving the patient, if you want to go to the bathroom for any reason, then you can put all the side railings on top. If you want to put it down, just pull it like this. Put it. Okay. Now, in case any difficulties, you can please ring the bell for any time. Beside this call bell, there are 2 more call systems in our bathroom. As a part of our fall prevention program, we assess each patient for risk of fall. And most fall risk assessment is done in every shift. Madam, since your patient is identified for high risk for fall, here are some points of awareness and precautions for you to follow. This is a fall risk assessment. Some of the patients that requires attention are convulsion, head injury, receiving high-risk drugs such as sedatives, narcotics, anti-epileptic drugs, etc., mobility and gait disorders too. And madam, there are some instructions over here. You can go through it. Such as take your time when getting up from a sitting position, particularly after emptying your bladder. Bring any walking aids if you have. Bring your spectacles with you to hospital. Familiarize yourself with your room, its furniture and the bathroom. Rest of them are mentioned in the form.
Call alert system. We have gone one step ahead to provide alarm system for the patient those who are having high risk fall.
There are 2 call bells over here. One is over here and one is at the shower point. One is nearby commode. You can just press this red indicator, and in the bathroom you have to just pull this bell. So it shows it at the indicator at nurse's counter as well as in the pantry. You will receive immediately one help.
And anytime any patients ringing the bell, so the red light flashes outside and it gets activated to the call bell at the nurse's station and one at the pantry. And immediately the help will go to the patient's room.
And there are grip bars. One is near the commode side and one is near the shower side. There is an anti-skid mat provided to prevent a fall.
We instruct everyone on visit in every patient's room and ensure everything is kept within the reach of the patient.
We also ensure that every time anyone visits the patient room, they should always check that the bed is at the lowest height. We keep an eye on high-risk patients for fall by taking frequent rounds in their rooms. When you hear an alarm and see the red light flashing, please look into the room while passing. Check to see if you can prevent a patient from falling.
Make sure one visitor is there all the time.
Several fall prevention tips are displayed for the nurses on the nurses' desktop and in patient rooms for patients and visitors. Remember, we can all prevent a patient fall and injury. Thank you for doing your part to keep our patients safe.